Perfect. Let's get started into the tissue injury cycle today. We're going to talk a little bit about the 9 different phases and how this will be incorporated. So remember, for your module homework, you will have to have this information learned, and it will be the 9 stages for the matrix. So as we get started with the tissue injury cycle, we know that there are 3 different phases. And so we can see that we have the acute inflammatory response, which we're going to talk a lot about, and that's all we're going to talk about in this video. And then we also will have the proliferation and maturation phases, which we're not going to spend as much time on right now. So when we talk about inflammatory response, we need to think about what is this. So anytime we have inflammation, we know that this is the local response of the body to an injury or irritant. And this is the body's way of saying, hey, something's wrong. So think of the idea that if something were to happen and you have a bunch of people around because of that, that's the same idea as the inflammation. And this is the main purpose to defend against foreign substances and also to dispose of dead tissue. So the idea of when an injury occurs and that tissue is now dead, we don't want it in the area anymore because it can cause more harm than good. So there's 9 phases of inflammation, and right now we're going to go over the 8, and then the 9th is the overall healing for the body. So we didn't talk about that one. So the first one's the primary injury, and this can be split up into 2 different things. So we have macro trauma and micro trauma. Macro trauma is an example of what you see here in this picture. That's that large injury of something causing the injury immediately happening. So the idea of impact, contact. This is the same thing of tearing your ACL, breaking a bone, a wound, anything that occurs in one fell swoop. The idea of micro trauma, this is that chronic or long-term injuries, and these are the overuse, friction. This is where all of your medial tibial stress syndrome or stress fracture fits in. This is where the idea of any tendinitis fits in. So you have a whole lot of trauma happening over a long period of time. So let's think about this in terms of tree branches. So if you have a macro trauma, let's say that you are able to grab a tree branch and then break it across your leg. When you break it that way, that's considered a macro trauma because that is all split, broken down in one time. But if you sat there and took that same piece of bark or of stick before you had done anything else to it, you'd be able to go through and you'd be able to continue to peel piece by piece off, and you'd eventually get to where the part of where it would be damaged and it would be noticeable. That's going to take a lot more time with a micro trauma than the macro trauma. And we can see some other things. So physical agents are going to be the more injury that we think of. We can also have metabolic processes causing injury, biological, and chemical. So the second thing we want to talk about is ultrastructural changes, and this is where the cell actually dies. So for whatever reason, whether it be that direct or indirect, the cell membrane is broken down to the fact of where it eventually breaks. So this is that same idea of what we talked about earlier with macro and micro, of the idea of a pounding strong force coming in and breaking in at once, and that's direct. Or we have indirect, and this is caused by 2 specific things. So either an oxygen deficiency, known as hypoxia, where there's not enough oxygen in the area, or enzymes, which are chemicals. And what happens is healthy cells that are near the injury site can also be damaged from it. It's that same idea as if something occurs around you, even if you are not primarily in the event, it still can affect you. The third piece of the acute inflammation is chemical mediation, and this is where the histamine, bradykinin, and other chemicals are released. And so what their purpose is they come in and try to modify and regulate the rest of the inflammatory response. And as those chemical mediators are coming into the body, they're going to try to be that first line of defense that's there to help with whatever is going on. And I don't care specifically that you know what histamine does, what bradykinin does, and obviously I didn't mention other chemicals, but just knowing that these are some of the first to appear to the area and provide that first area of defense. So let's recap so far. So the first one we have is primary injury. That's going to be the first thing that occurs in an acute inflammatory stage. After the primary injury happens, right away ultrastructural changes happen because of that. And so cell death occurs immediately. and that's either direct or indirect, depending on what tissue is targeted. So for example, again, if you sprain your ankle and your anterior talofibular ligament is damaged, you're still going to have potential issues to the foot, potentially because of hypoxia, but you're going to have an increase of inflammation in the area caused by those enzymes and chemicals that can cause indirect structural changes too. And the last was that chemical mediation, so that histamine bradykinin getting to the area first to be that first area of defense. So then what happens? So our body is built to naturally protect itself. We talked in 212 and in other classes that you have taken about the idea that when the body is injured, it is going to it's going to do everything within its power to be able to protect itself from furthering injury. So the idea of going into a muscle spasm to protect the bone if there's an injury. Well, the same thing happens within the body. And so we know that when an injury happens, the blood flow is going to be altered. So the very first thing that happens is the arteries dilate. And this causes an increase of blood flow to the injured area. And because of this, we kind of think, that's a little bit opposite of what we want to think. But how do those chemical mediators come to the body? Well, we know that they come through the blood. And so having that ability to get extra blood in the area to get those extra helpers is vitally important. And so our arteries are dilated. There's now an increased volume to the area. So not only do we have the injury, but we have a lot more people. So that idea of if a car accident happens and a bunch of people get around, it might make it a little bit harder for EMS to get in the area because there's just so many people. And this is where you can see the idea that we first kind of overreact in the fight or flight, and then we'll eventually go back into the body's ability to take care of itself. And this is when the blood flow starts to slow down. So this hemoconcentration occurs, and then white blood cells can then move into the area. And so when this extra blood's coming in, we then eventually start slowing down, and the white blood cells can actually form like a little band-aid or a clot in the area. And between the leukocytes and the white blood cells, they fall out of the bloodstream and are then able to continue to help that vessel wall that is damaged. And that's that endothelial wall, and that kind of covering occurs then with the hemodynamic changes. We now have metabolic changes, and in this area, we know that there's going to be decreased energy. So the use for ATP is no longer being used to create that anymore because we know that there's something more important. There's going to be decreased oxygen, naturally, hypoxia into the area because the cells will switch from aerobic to anaerobic because that decreased energy occurred and they have to get energy somehow. And this is where glycolysis then happens. So glycolysis is the conversion of glucose to lactic acid when there's not enough oxygen. And this is concerning because we have an injury now and there's going to be glucose in the area because there's an increase of blood flow. And now this glucose is being switched to lactic acid. Well, lactic acid can then affect the stiffness and soreness of a joint. We also know that we talked about the sodium-potassium channels, but in this case, whenever you have an injury, the sodium pump maintains the concentration of sodium at a very low level. So the body wants less sodium than normal, and so when this is occurring, membrane functions continue to slow down. A few more things that happen here. Sodium then all of a sudden speeds back up within the cells and organelles, so that way they're able to take care of themselves and what they need to. Because of this, we know that there can be an increase of water sometimes and the cells will burst and die. And then within this, the same idea, after all this happens, the membranes can attack and can actually be digested within the cell. So now we talked a couple steps earlier how we have histamine and bradykinin that come to the area, and they are able to kind of be that first line of defense. Well, they are able to increase the permeability of small blood vessels. And so they come in and they make it easier to be able to get into these small blood vessels that have been endangered. And so within this, we know that there are additional gaps that happen because the endothelial cells contract and pull away from each other, and are able to allow the white blood cells to go out of the vessel then and go directly to the injury site, which is where we want them to be. The next step is leukocyte migration, and this is really important because we know that, as we talked about, the white blood cells are there. They're on the endothelial wall, and they can then start kind of clumping together. So they form together, they move out of the vessel, and get to where these gaps are in the endothelial tissue. Now we know that there's two specific types of leukocytes with inflammation. We have our neutrophils and our macrophages. And those neutrophils, they are that very, very first type of true help that appears. So we've been able to break in, and now we need immediate help. This only occurs for about the first 7 hours with the neutrophils, and the neutrophils don't work after this. So this is that idea of when you have an injury, it is so vitally important to take care of it right away, because after that, those neutrophils are not coming back unless a new injury happens. Then another type of leukocyte that comes to the area that's important are the macrophages. And these are the guys that can stay and live for months, and they're able to reproduce. So this is that long-term effect. And I'm going to do an analogy a little bit later that will probably help you keep that terminology separate a little bit more. And the last guys are the phagocytes. And with phagocytosis, this is what I call the Pac-Mans. And these guys are the guys that come in, and they are the cells that eat everything else that should be removed. So they come in and are chomping away, if you can think of a little Pac-Man, to get all that debris out of the area that's causing pain, that's causing swelling, and all of those issues. So let's kind of take a step back and think of where we went. So we've officially now gone into the body with the primary injury. So something has happened, whether it be chronic or acute. We then move to the idea that the cell's going to break down because of the injury. Because of this, we know histamine and bradykinin, which are very important because they're going to bring some important pieces to the healing site, are then released and begin their journey. Blood flow increases initially and is able to get additional blood down. White blood cells and leukocytes kind of form that band-aid. And then our cells go from aerobic to anaerobic. Within this, we now know that the histamine and bradykinin have gotten to the area. These small blood vessels are able to say, hey, we can't handle this. They kind of clump together, move out of the way, and allow the white blood cells to come into the actual injury site. At that part, they bring leukocytes. Leukocytes are our favorite thing with injuries. And the neutrophils immediately come and help, and then it's followed by the macrophages. And then at the very end, that phagocytosis occurs where Pac-Man chomps and eats all of the foreign matter that shouldn't be there anymore out of the way. And so this is kind of just a little chart of what we went through to help for those people who like to look through more of an algorithm idea. I'm going to kind of just breeze over this a little bit because I think it's something that a lot of people are familiar with, but it's important to know the cardinal signs of inflammation. So we need to know that there is heat, redness, swelling, pain, and loss of function that all occurs because of inflammation being there within the body. And this is just the same thing. It's just kind of explaining which specific physiological response causes each of the different cardinal signs of inflammation. So we've talked all about inflammation, and when I think of inflammation as a student, the first thing I thought of was, oh, that's bad. That's what happens when you sprain your ankle. But actually, when I mentioned everything to you guys today, it kind of sounds like a good thing, because without inflammation, there would never be the chain effects to eventually get the neutrophils and macrophages to the injury, so no healing could actually occur. And so it's something that I want to debunk the myth of right now from you guys. You cannot stop or reduce inflammation. All that I told you right there, that body's going to do what it wants to do. But we can try to help minimize signs and symptoms. So let's think about it from an ice sort of way. So if you put ice on an area, the blood vessels go from vasodilation to more of vasoconstriction. That means less blood flow, which can mean an issue of not having as much neutrophils and macrophages, but can also mean that there's less debris brought to the area. And so with inflammation, remember, we can only try to minimize that secondary injury that can occur. And so keep in mind, swelling and edema are not the same. Edema and inflammation are not the same, and none of them are correlated together. So swelling is different than edema, which is different than inflammation. And we talked all about inflammation. We'll touch later on about swelling and edema a little bit more. I talked about that secondary injury that we want to reduce. So what is that? And that's that idea of if you have some sort of enzymatic or hypoxic issue due to chemicals in the area or a lack of oxygen and further damage. So the idea that when swelling lingers in a body, it's causing more and more damage as it's there. Within the ischemic, you can kind of see the breakdown of some of the more specific physiological functions that it does, but both of them are very negative to the patient. And so anytime that we have some sort of reoccurring or chronic inflammation, here's what's happening. So this is that micro trauma. So if you have recurring inflammation, this means over and over and over, the acute inflammatory process is going to begin before it has actually resolved. So that idea of you sprain your ankle and it's starting to heal, and then you sprain it again, and then it starts to heal and you sprain it again, that's reoccurring inflammation. Chronic inflammation is the idea that the inflammatory response was not able to take care of the injury. So the idea of shin splints, where the inflammatory response has gone through and gone through, but it's just not able to take care of what has been injured. I mentioned swelling a little bit later on. That's an increase of volume in the area. So all of the stuff that's in the leg together is going to be the idea of swelling. And anytime we think of hemorrhaging, that's the initial bleeding, and that's why there's an initial swelling for patients who have injuries. So I like to use analogies, and here's kind of where we're going to go with the tissue injury cycle. So that macro trauma has occurred, and so we know that this can be correlated to the idea that a tornado has come into the area, so like the anterior talofibular ligament. We know that the tornado is going to go through, it's going to hit a specific small area of places, but that doesn't mean that everything else around it isn't damaged because of wind and rain that comes with the tornado. So the idea that maybe we only sprained the anterior talofibular ligament, but there's going to be damage surrounding it also. Those neutrophils are kind of like our fire and EMS. So they come into the area and do that very initial save. And they want to try to save all the tissue. They're very aggressive. They work for only about 7 hours, remember, and they can't be replicated. So that idea of first responders only. But, 7 hours isn't enough to take care of something after a tornado. And so when we have the next step come in of other chemical mediators. And this is where the macrophages are able to come in and be that second line of defense. So they're that backup to the emergency responders. They are able to come in and continue to help the area. And we know that things are going to continue to happen. The proliferation phase, which can go on and on and on, this is the idea of like the Red Cross coming in. And this can occur for a long time after injury. And this is where people need as much help as they can, or the body needs as much help as it can to fix itself from an injury. And then the very last thing is maturation. And when this occurs, we know that sometimes the body just has to do its own. So we no longer need the chemical mediators, and it's able to return itself back to normal blood. I hope that was a way to help you understand it just a little bit better. Please let me know if you have any questions, and this again is the information that will be on your matrix.